one.
Good afternoon. My name is Natalie.
And my name is Shelia.
Thank you for joining us for today's SITREP. As always, before we introduce our guest for this week, we will discuss MVPN and the Veterans One Stop. So as you know, for Military Veteran Peer Network, we offer peer support services, community resource assistance, and volunteer opportunities, as well as trainings. So for the peer support services, we do one-on-one peer support and peer support groups. So the one-on-one peer support, we like to consider it our battle buddy type program, where you and a volunteer get together and you determine when and how often you talk to that volunteer, just so you feel like you're getting the support that you need. For the peer support groups, we have Yarnaholics, which is our crochet group. We have Pathfinders, which is our general peer support group. We have the other side, which is for dependents and family members. And then we also have Haven, which stands for Harassment, Assault, Violence Ends Now, for anyone who's experienced sexual harassment or sexual trauma. And that's it for the peer support. For the community resource assistance, we help with a wide variety of things. So there's nothing too big or too small that you can come to us that we can't find an answer to, or refer you to the proper organization that can help you with whatever assistance that you need. For volunteer opportunities, we're always looking for volunteers to help us in facilitating groups, doing outreach events. So if you're interested in volunteering with us, please feel free to reach out to Shelia or I. And lastly, our trainings. We do offer suicide prevention, suicide awareness trainings, as well as parent cafes and military cultural competency. For the suicide prevention, suicide awareness trainings, we have Ask About Suicide to Save a Life, CALM, which is Counseling on Access to Lethal Means, SAVE training, which is in collaboration with the VA and Mental Health First Aid. Like I previously mentioned, we also do parent cafes, which is in collaboration with the Center for Children. And the parent cafes focus on the 5 protective factors to build a healthier foundation within families. And the military cultural competency is just for anyone who wants to be a little bit more culturally competent as far as the military, if they serve them in the military, or if they are just working along the SMVF community. But that's enough of me rambling, and I will turn it to Shelia now.
Thank you. I appreciate it. So I'm going to talk about the Veterans One Stop Center before I introduce our guests. So the Veterans One Stop Center offers free mental health services to veterans, service members, and their families. It doesn't matter your discharge status. It doesn't even matter what era you served in. We're going to get you squared away. They do individual counseling, marriage counseling, and family counseling. We also have housed here at the Veterans One Stop Center, we have Texas Veterans Commission's Claims Department. So if you need assistance starting your claims, they can get you squared away. Veterans Business Association, so anything pertaining to business, they can answer those questions for you. We have Grand Canyon University here. You don't have to be going to that university to get assistance with anything regarding education. We have SUD employment here, which is substance use disorders. Pretty much if you have any issues when it pertains to substance use, they can get you squared away with employment. We have the CHW, community health workers. They're the ones that's, out on the street talking to people in need and finding out what resources they need and getting them squared away. We also have OSAR here, which is outreach, screening, and referrals. I can't think what A is, assistance and referrals. So they help with substance use disorders, or issues rather. It's from alcohol to anything harder. They can get you taken care of. And I think I covered everybody that's housed with us. So I'm going to go ahead and introduce our guest who's patiently waiting to speak. Mr. Rondriques Jackson. He is the Director of Business Development for a Paso Behavioral Health System. I had to take a break, get the air in. So I'm going to go ahead and turn it over to you, Ron.
Hello, everybody. My name is Ron Jackson. So at Paso Behavioral Health, we provide stabilization and treatment for those who suffer from suicidal and homicidal thoughts on harming themselves and others, those who suffer from anxiety, depression, trauma, post-traumatic stress syndrome, substance abuse disorders, or need a detox. We have a special, here in our Paso Behavioral Health Systems, we have a specialized unit for a specialized population. We have a children and adolescent unit, an adult unit, a geriatrics unit, a dedicated women's unit, and a dedicated unit for our active duty service members and veterans. What sets us apart for all the competitors in the area is we're the only facility in the area that offers treatment to children from the age of 5 to 17 in the inpatient and outpatient setting. We're the only facility in the area that has a dedicated women's unit. And we're the only facility in the area that offers ECT, electroconvulsive therapy. So how do we do this? We use evidence-based modalities such as CBT, CPT, DBT, and EMDR. We have in our facility, you can come and get a free assessment, no charge, in a safe, secure, and supportive environment for our inpatient and outpatient settings. So not only we can treat a patient for inpatient settings, we can treat them in outpatient setting as well. Our Paso Behavioral Health Systems have 2 outpatient locations here in El Paso. One right across from Del Sol on the east side, and one downtown, right behind our 1900 Denver Avenue facility.
You're coming in broken.
We have 2 outpatient locations here in El Paso for outpatient setting. We have one across from Del Sol and one at our 1900 Denver Avenue right in downtown facility. Our facility actually also hosts a 28-day detox substance abuse program. We also have a dual diagnosis program to where we can treat you for a substance abuse or alcohol disorder and a mental health crisis at the same time. We also provide transportation. So if you need transportation to your outpatient appointment, we'll pick you up in the morning, feed you breakfast and lunch, and have you back home before the kids get out of school. We also have a full-size pool, aerobics fitness center, a weight room, and a huge basketball court for you to just relax and just hang out like wet clothes. We got what you need and most of what you want. And if it's something you want that we don't have, it ain't worth having. Thank you for your time.
No, thank you for your thank you for joining us. I think I did have a question. So obviously you serve the general population as well as the SMVF community. Is your services free, or do they need like insurance to get seen at Paso Behavioral Health?
Yeah, so we take most insurances such as TRICARE, Medicaid, Medicare, Blue Cross Blue Shield, Aetna, Western Sky, and many more. But if there's some reason that we have a veteran that comes in our facility that is not unfunded, we still have some unfunded beds, but we'll actually find a way using a peer network to try to get them some funding through EHN or something like that so they can get some treatment.
Okay, that was the main question I had, but I think you covered most of it and a lot as far as what your program offers. Natalie, do you have anything?
I don't have any questions. Thank you.
All right, well, thank you for joining us. You stay safe out there.
All right, thank you guys for your time.